Well, welcome back. Joining me this morning is Dr. Chekakie, and he is a cardiologist here in Cheyenne. And you're here to talk about sudden cardiac death, and that's kind of a heavy subject for bright and early this morning, but it is something we all need to be aware of. And I was thinking about this when I was looking over my notes last night, because my mom had a heart attack at 40, so that's pretty young, and I was there when she had it, so it was a little traumatizing. But
I bet it was, and she's really young to have that heart attack. But sudden cardiac death is defined differently, in the literature sometimes. But in general, it's defined as death within 1 hour of the development of symptoms. And some people define it as death within 24 hours of the development of symptoms. But if you look at the population of the United States, 200,000 people die suddenly annually.
wow.
That's
And
a
now,
big number.
what are some of those symptoms that people notice leading up to that?
Well, sometimes the symptoms are sudden. Some people will have chest pain and they will have sudden heart attacks. Some people actually die suddenly in their sleeps. And some people die during sports, and we have seen these sad events over and over again. And sometimes it's hard to screen people to know who is really at risk of dying suddenly.
Right, and it can sort of affect people from different ages too. It's not just the elderly, because you do see those sports stars who look like they're in their prime, and then it's just done.
It is, and if you look at young people, the causes of sudden death in young people differ from the elderly, but in general, coronary artery disease accounts for 80% of the cause of sudden cardiac death.
Wow. Now, you can use a defibrillator to help. Now, what do people feel having several shocks of this machine?
Well, the defibrillator is a small device. It's implanted under the chest, and it has 2 wires going to the heart. It can detect dangerous rhythms and either pace people out of it or shock them out of it. The shock is intense, and people will feel it. And if they have repetitive shocks, they will get anxious. They get symptoms like post-traumatic stress syndrome. It's very traumatizing. So sometimes some people will associate it with certain activities, and they try to limit their lifestyle. And what we try to do is to help them, since this device has saved their lives, but we don't want them to live in pain. We either give them medications to make these arrhythmias go away, or do a procedure called an ablation procedure to treat these circuits.
Okay, yeah, I know that when my mom, after the heart attack, she had anxiety attacks that, she'd get a little flutter, and she would think she was having another one, so.
And it is very, very traumatizing and very limiting, and we want people to enjoy their life.
Right, right. Now, what can people do here in Cheyenne, and what's available for them?
Well, we at Cheyenne Cardiology Associates and at Cheyenne Regional Medical Center, we have established the electrophysiology program. We can treat these arrhythmias here with medications, and we also have done the ablation procedure, which is simply putting a deflectable wire in the heart, looking where these circuits and dangerous rhythms are coming from and causing these repetitive shocks. These can tell us where the healthy tissue is and the scar is, and these circuits come from the borders of the scar, and we can burn it, and the patients do well in general.
Okay, well, thank you so much for joining us, and we're going to leave you now with your look at first local sports.